Okay, let's go ahead and call it meeting to order. Go ahead and take the roll call. Micah,
Here.
Cindy,
Here.
myself, Jared is here. Marlene,
Here.
Joe,
Here.
and we have two absent. Approval of the agenda.
This is Joe. I move we approve the agenda.
I'll second.
All in favor?
Aye.
Aye.
Approval of board minutes from April 25, 2024 board meeting.
I move we approve the minutes for April 25th, 2024 board meeting.
Second.
All in favor?
Aye.
Visitors' comments. No one on the. Okay, seeing none. Board member comments? Marlene,
Congratulations to the Petersburg High School graduating class, and I hope some of you see your future as partly being a healthcare provider and perhaps in Petersburg.
or any other board member comments? Committee reports, resource, do you have anything?
I do. I wrote a couple little notes and feel free to add if I didn't hit some salient points. There are some annual expenses like insurance that are going to be coming due soon. Net patient revenues are being held steady due to lower expenses. We are working on rate reviews as well. We had some discussions about long-term care days. They're up from last year. Mammogram exams are increasing, and there was also an interesting note about discussions on swing bed trends. Excuse me, changes in postoperative care seem to be driving down swing bed days. And for folks who don't know what swing beds are, it's a critical access hospital service that allows a patient to transition from acute care to skilled nursing care without having to leave the hospital. But the way that post-surgery care is being handled has changed that to some extent. And then we talked about quite a few things, but in general, hospital finances are holding relatively steady.
Thank you. LTC,
I also attended that meeting. I'm afraid I'm going to dominate the meeting this time. Some of the topics that we included in discussion for long-term care included some facility maintenance, including septic line replacement and air handling is going on right now. Staff is working on emergency preparedness details and some security processes. Helen Boggs mentioned establishing a restorative program, and this was selected as a performance improvement project. And that refers to tracking care of patients. And Phil, you may be able to describe that a little better. I had asked Jen for some details, but get it. But it's basically tracking patient care and.
For a quality improvement
Mhm.
project, yeah.
And then staff is reviewing the quality assurance and performance improvement plan with the goal of excellence in healthcare services and promotion of community wellness. The facility also had an unannounced federal recertification survey, and a follow-up survey verified any deficiencies were corrected, and PMC was found to be in compliance with state healthcare requirements.
CAH,
I also attended that meeting. We discussed the development of a facility-wide safety plan, in other words, a unified plan to include security, medicine safety, patient safety. It should be noted that these are addressed elsewhere, but not necessarily in a consolidated plan. So that's the goal, to get a consolidated plan together. The hospital did have a cyber attack, but thankfully not a sophisticated one. It sounded like more than anything else, it impacted wasting a lot of paper on a printer. The IT staff is following up to ensure that there are protections. And staff also put forward strategies to improve utilization of information required for reporting and patient care. The clinic addressed reporting and their focus this year on hypertension, diabetes, clinic access to care, transitional care, and prenatal care metrics. And it was noted in the skilled swing bed report that we're networking with other hospitals and that most of our non-local skilled nursing patients are coming from Bartlett and Juneau. And PMC skilled nursing is staffed 24/7 by RNs. And so we can provide IV therapy and medication management on a 24-hour basis.
Thank you. Okay, reports, pharmacy. Did we have any comments or questions regarding the report from pharmacy? If you want to have, if you have any comments on it, you can highlight it.
In staffing, I was out of town for most of April. And with a lot of work ahead of time to see that pharmacy ran on autopilot as much as possible, Jolene was able to handle everything that came up during my vacation. So that was very good. The clinic medication project, we just finished implementing the new medication scanning project, and it went relatively well. And we are looking forward to better medication safety and also more reliable charging of medications so that there's not the delays that sometimes occur when we can't get a medication charged on an account. So that seems to be working better than it was in the old system. Questions?
Thank you for that report. Case management, swing bed management report. Did anyone have any questions regarding that report? Thank you, Elizabeth Hart, for that report. Chief of Staff, Dr. Hulabet. Report. Questions regarding that report? Thank you, Alice, for that report. Clinic. Okay,
You can use the mic if you could.
Hear me?
Yeah.
There we go. Can you hear me now? Okay. It's always nice that we have the chief of staff and clinic at the same time because some of the things overlap. So, I noticed in her report, and I was going to be on mine as well, is that Dr. Morgan or Dr. Justin Morgan accepted a position with PMC. And so he'll be starting in August. And so we're looking forward to him joining the team. And then we've been, as mentioned earlier, a hypertension quality report, which we've been focused on getting education and outreach out to patients for hypertension. And there's been outreach efforts with the health fair and community blood pressure screenings. And then we also have a remote home monitoring system that we want to get more out there. We only have a handful of patients on it, but people that want to monitor their blood pressure can take these devices home and we can actually see the results as clinical. We have clinical staff that can review it and follow up with patients. So it's a really good opportunity. And we use that through Health Snap. And then we've been focused on some other projects outside of the typical day-to-day operations as chronic care management. So having case managers follow patients that need support with transitioning of healthcare needs, whether they're getting medevaced out and coming back, or that transitional care management from being on the inpatient unit to the outpatient setting. So we work with Jennifer's team and the nurses when they're in our facility, but also when they've been sent out to other facilities. We have Amy Hollis, our case manager, that tries to help connect the patient back with records and getting reports back and making sure that their transition back goes well. The other thing I've been monitoring is our access to care. So looking at our clinic volumes, referrals, how many referrals we're doing, and then as well as access to care of our providers. Our volumes are looking good. Our referrals were down a little bit in this quarter, but I think that's probably because we had one less physician referring out patients with Dr. Heyer not being around. So it makes sense. It was all, the numbers looked normal to me. And then we have improved our access. So we reported out last October to now, and we're tracking like how long does it take for a patient to get in for an acute care visit. And our availability looks better now than it did in October. So it could take, 1 to 2 days to get in quickly for something that was acute. But back then it was 11 to 16 days. And now we're down to 8 or 9 days if it was not a acute issue. So that's showing an improvement in access to care. And the other thing that we track regularly is our same day appointments that we schedule. So it allows us to make sure we have enough availability on a daily basis. And usually we're scheduling about 10 to 12 patients per day of just getting a phone call that day. But in the February, March months, we were seeing that increase quite a bit. It was closer to 15 to 20. So we were feeling busier, and then our numbers also track that. So it's been a good kind of new metric we've been looking at. That's it for me.
Any questions for Kelly? Yes, Joe?
Yeah, thanks, Kelly. I just had a question on the next available reports. When you just talked about that, how for like the next available open and third available open, those times have improved since October. How has that happened? I mean, is it that like are the physicians, physician assistants, nurse practitioners, are they like working longer days or doing more appointments, or I'm just trying to figure out how
How we can see the improvement.
how that happened.
Yeah. Yeah, I mean, a lot of things play into that our availability. And it is like provider availability. I think adding our mid-levels to the clinic has increased our availability. So we have a nurse practitioner and a PA that are in primary care only. So that allows for quicker availability in that way because our doctors are pulled in many directions, long-term care and acute care and ER. So that probably played one thing. Maybe at that time, we also maybe had staff out. So if someone is on PTO or out, that will affect the numbers. And each provider has different availability just depending on a variety of reasons. So we're kind of looking at that. It is a hard number to make change on. Sometimes I'm like, how can we change it? I mean, we'll see it change when we have our our fourth doctor here again. So when Dr. Morgan starts, I would expect we would have more availability then. So we'll probably see a change in October when I talk to you again.
Thank you.
Mhm.
Any other questions for Kelly? Thank you, Kelly, for that report. Community wellness. Comments on that one there? On your report? No, this is community wellness by,
Oh, I don't have any particular comments unless anybody has questions for me.
any questions on that report? From Julie? Jessica, Joe?
Yeah, on the Julie, you had a bulleted point on suicide prevention. You mentioned the wellness department has established partnership with the Juneau Suicide Prevention Coalition. And then you mentioned the staff are participating in the newly formed Regional Alliance for Southeast Alaska. So is that, I was curious, how many people are involved in that from the wellness staff? Is that you, or are there more?
There's 2 staff
Two.
that have been kind of working with them. So the staff members that have been implementing the youth mental health first aid trainings, that's kind of where it started. They got trained in a couple of evidence-based curriculums, and then those trainers in Juneau kind of partnered with them and brought more resources to the community. So our staff has 2 people that are working, meet semi-regularly with the Juneau Suicide Prevention Coalition and learn from them what resources they have available, and have brought in some additional trainings and resources to our community.
Okay, yeah, that sounds great. Thank you.
You're welcome.
Any other questions for Julie? Thank you, Julie. Dietary. Any questions on the report from Jeanette?
No questions, but I'm always amazed at what you're able to accomplish with all of the equipment issues that go on in the kitchen.
Yeah, this is Jeanette Ely. Speaking of equipment issues, last Friday, our walk-in freezer went out. And a big thank you to the school. They were able to make a little room in their walk-in freezer. We could immediately transfer all of our stuff over. We didn't lose any product, and Island Refrigeration was able to come out on Friday at 3:30. It was really great. Got it running again. Need a new compressor ordered. So we are continuing to keep as much product at the school as possible. And I'm just bringing little bits over at a time, so.
Thank you, Jeanette, for that report. New facility, Arcadis.
If you could use the mic up there, that would be good.
Hey, everybody, Justin Wetzel with Arcadis, on behalf of PMC. I can give a quick update here. On site work, Dawson and their subcontractor, Rock and Road, will be completed with all the import fill on the hospital site by the end of May. All the blasting has been completed, and that area has been cleaned up and segregated, and we've basically crushed a lot of that material on site, and it'll be used on site for top course. So it's going extremely efficient out there. Basically, less moves, to sum it up. In terms of the next steps for contracting, we just received the 65% design drawing guaranteed maximum price cost estimate from Dawson. So that's kind of what we were waiting for. So we just got that today, actually, and the next steps for that is going to be analyzing those cost estimates to the budget, trying to get those in alignment. And if we can get those into alignment, the next step from that will be to put that in front of the board and the borough for approval. And this next estimate basically is going to cover full construction. So it's going to be through final completion. And just to give a little more information on the process with the delivery method we're using for this project is basically the cost estimate for the 65% is, it has allowances built in to get to the 100% construction documents. So that process is going to be, we're going to have some contingency funds built into the budget to cover any kind of design modifications that happen from the 65 to 100% drawings. And there's a lot of opportunity with this delivery method of construction to, versus a bid build project where you have a concrete cost, and that is what it is. If there's any kind of design modifications, then it's change orders. In this version, it essentially ends up being is an actual cost to complete. So we're paying for in terms of, for example, the site work, we're placing that material and we're paying for a unit price put in place. So there is, no additional costs for that work. We're basically paying for the exact cost of that work. So it's a very efficient and cost-effective way to deliver the construction project. questions? Sorry, maybe that was too much detail. Happens. So yeah, the final drawing set we'll be doing a review permit set in June. Petersburg will be delivering that, and that'll also go to the fire marshal for a final review. In terms of actual construction on site, they've already started placing material and building forms, and we've been pouring concrete starting since last week. So grid line 1 concrete is being put in place. They're bringing over a concrete pump truck to do the wall, and then they'll basically just continue to follow around the perimeter with footings. The goal is to get steel started in July, and right now we're on track for that. We're working through the design details of the structural steel, and as soon as that gets put into full fabrication, we'll expect to see that in Petersburg probably sometime in June. I guess looking at the overall goals for the project in terms of milestones is obviously getting the roof on by September, in terms of seasonal constraints and making sure that Dawson's working in best possible conditions.
Do you want to share, if I may, do you want to share a little bit about the site work and so that the GMP model related to and some of the efficiencies we have to date?
Yeah. So just to kind of give a summary and kind of recapture kind of where we're at to date in terms of budget is, things are trending really well on the site work. And we had a budget for the site work, and the actual material put in place is coming in under what we anticipated. So, we're basically going to recognize cost savings there with the site work in terms of what was actually placed and what was put in the budget. So, and that, in terms of that, opposed to the bid build process, you have one set amount, and that's what it's going to be. And in this delivery method, you have the opportunity, like I said before, to capture the actual cost versus what was in budget.
So just a few things. We had gone to the borough to ask for a waiver on the mud dump fees, which they granted. And then we also asked when Rock and Road asked to build out the gravel pit. Those things made a huge difference on the budget. They really helped the bottom line. It also helped in efficiencies, like Justin was saying. And so really want to compliment the subcontractor and, Rock and Road and Dawson and Arcadis for working together with in that project. So it's a hard thing to do, stay on budget in this climate. So
It is, yeah, that's a really good point. Phil, budget it's the last couple of years, I would say it's really difficult with cost escalations to try to deliver the project within budget constraints. And like you mentioned, another, like you said, Dawson and Rock and Road both have been, it's versus a bid build, this is more of a, this type of construction it's a partnership, basically instead of just a lump sum bid number, you're partnering with a design team with Petersburg, and you're partnering with a contractor, and you're constantly making micro changes to maximize efficiencies and come up with ways to perform on the project and deliver it at the lowest possible price. And those opportunities just aren't available on a regular bid build. Any other questions?
Thank you for that report.
Thanks.
Quality and IP report. Did we have questions on that report? By Stephanie.
it was very cheering to read that report.
Yeah, we'll actually have a little presentation here later on that employee survey and some of the findings there.
Questions on that one? How about Jennifer's infection prevention? Thank you for those reports, Jennifer and Stephanie. Executive report.
All right, seems like when I wrote this report, a lot more has happened, so maybe I'll update some of the newer items. Is there any questions on my written report before I provide some of those highlights? So a couple of things, like Jeanette mentioned, we had to deal with the freezer issue in the facility. So another thank you to the school, you know, on a Mayfest Friday afternoon at 3 and 4 o'clock, you know, contacting Erica, Carly and Heather, and they were very responsive and helping us out was really was great. And then also Island Refrigeration was here in no time, same day, and getting things going. So, and of course, facilities asking Wolf to come back in. So big thank you to the school for helping us out with that. Also, thank you to the Petersburg Community Foundation. We attended with Becky Turland and Katie Homeland on receiving a grant, almost $10,000 for teen mental health training. Really want to thank the Petersburg Community Foundation for putting that on. That was at Glow's house again this year, which was great. And then just a few comments. I mean, I was kind of taken completely by surprise on the KFSK article on Stedman's comments related to the facility. So I just want to, you know, comment a little bit on the process. We've been going to the assembly, voting on the capital budget process the past number of years, even since it was in the CAPSA system, since even before I got here. And the goal has always been to provide a phased approach. And, you know, when we met with Senator Stedman earlier this year in February, we explained everything where we were, what the funding was. We had Jason there, we had Jared there, Bob Lynn was there. And we explained exactly everything where we are. We were advocating for capital budget, and you know, the assembly voted it as the #1 priority. And I went back a few weeks later, same thing. You know, we did hear that it was a tight budget, always knew it was a tight budget. Never heard any unfavorable response, but I hope that's not the case. And, you know, to me, it's concerning as we think about the project. We obviously need support in order to complete the project. So more to come on that. I haven't had a chance to reach out. I did provide an update to Senator Stedman's office on April 30th, providing the flyover look of the site and just saying, if you have any questions, thank you for your support. Sent an email to that. So in any case, you know, it came a little bit of a surprise. I hope it was just more of a funding issue than anything else, but you know, we'll continue to advocate. Let's see, the survey, we had the employee forum. Let's see, a few weeks ago, was it a week and a half ago, 2 weeks ago? And right before that forum, we asked, we wanted to get a satisfaction survey or a customer service survey or a survey from all staff on where we, you know, kind of get a benchmark on how everyone's feeling, and we'll have a presentation on that here in new business. Katie, our grants coordinator and manager, will help. She analyzed some of the data and will help provide a high-level overview of that. So again, it was overall positive, but there were certain areas we want to focus on and have some action items for improvement for next year. So that was good. Katie's also been super busy with our staff. I gave a list of all the grants that we submitted that Katie worked with departments on submitting on behalf of PMC. for some of the projects and also the Denali Commission grant for the facility. She also helped with the appropriations requests as well, so. Jason will cover the financial reports, and we had a overview of the new facility. A nursing ceremony with a pinning ceremony for UAA nurses. Huge congratulations to our two wonderful new nurses, Kelly and Jordan. And they were on PMC Live today too, along with Jennifer, who's running the program. And that was really nice to attend. It was a great response, and thank you for Cindy for attending there. That was wonderful.
I have to say, I was impressed at how many people from the community came to that as well. It was really moving.
Yeah, it was. Jennifer gave her. I know how you like public speeches. So really a moving speech, though. It was very thoughtful, and it was a very moving speech on that. So. Let's see, Paddle Battle is Saturday, July 27th. It's our annual fundraiser for scholarships and education support. So we're very looking forward to that. I'm glad we have a little bit of lead time here to get that together. We met with the foundation and working on getting some promotion out there and some prizes, just like last 2 years. See, patients and wellness. I think Kelly covered a lot of the activities going on in the clinic. We had specialties, working on specialty increases. We had our dermatology clinic this week and seeing lots of patients. So I've had actually a few emails from patients, real positive comments related to the service. So I'm very excited about providing that. And at the same time, we also had optometry here this week. I think Dr. Kapp was here for almost 10 days, so I'm really grateful to have those services continue. And I think that is it. And I attached a PowerPoint just for informational purposes from the employee forum.
Are there any questions for Phil? Thank you, Phil. Financials?
Pull these up real quick. Let's see. Ready? Should be, yeah, we see that. It's kind of small. Apologize about that. I wanted to say a few things before I get into the financials. First of all, I wanted to give a shout out for Justin. I wanted the board to be aware. I've peppered him with some very strong questions this morning and in some previous meetings, and because he's got a big set of shoes to fill. I mean, Jay is an absolutely outstanding owner's rep with his years of experience, and I'm sure he feels a little nervous coming in, but I was very impressed with his answers and for his approach and what's going on at the construction site up there. And I just wanted to point out that we've done the very best we can to fill Jay's shoes with Justin, and I'm very confident, look forward to working with him on this project. The other thing I wanted to give a shout out on is we're working on the budget. By next month, we will bring to you your budget. And in reality, there'll be no surprises if we go down through the financial statements here in a minute. You'll notice that we're under budget. We could practically just photo this year. And why is that so? I have to give credit to all of the department managers, every single department manager up there. When we sat down a year ago, we identified a variety of different projects to work on to improve access to care, the patient's experience, to create efficiencies, and just, many of those things have come to fruition over the course of the year. You've heard some of those tonight. For example, the recruitment and retention of staff is so critical to financial success, quality patient care, and the celebrating the, being able to grow our own nurses is such an awesome experience. What we're seeing in the dietary department and some, changes in leadership that happened there over a year ago, and being able to recruit and retain staff and to be able to advance excellent, food is really an important contributor to healing and to quality patient care. And I like what IT has done with regards to implementing this new software system where the doctor walks into the room and begins speaking about what's going on, and it's recorded automatically through AI into the patient's record, makes their time much more efficient and improves the accuracy of the documentation. It decreases denials that we experience from insurances because things are more complete. So every department has tried to identify ways to adapt to this future of healthcare where we have lower reimbursements by creating efficiencies, and it shows up as we look at the financial statements. Good financial performance is really just an indicator of, well, let me say it simply. When we look at the stock market and we say, what does the stock market teach us about the value of a business? And it says that emotion is the single most important factor in determining the value of a business. When we are scared, value goes down. When we're optimistic, value goes up. And that's very true for a hospital as well, an individual business. When we work together as a team, when we have a positive outlook on the future, when we have high employee engagement, we'll get to see some of the results here, then the value of the organization goes up. And we've seen over the course of this past year an improvement in our financial value or financial performance. And it has everything to do with how the team came together and improved the emotion of the organization. So just wanted to give a shout out to that. Let's see here. Let's go down through the financials really quick. Gross patient revenues, as you can see here, more so on the patient side. This is for the month of April. And you can see that the clinic is pretty much on par with regards to the revenues that we had projected to incur for the month. Outpatient is down and some of the other areas are down, mainly because as we got into the first part of it, we had projected in the budget that we were going to increase rates almost 20%, a variety of mechanisms in order to be able to improve the financial performance of the organization over the prior year. But as we got into the year, we've seen a couple things happen. Number one is we were able to work through the rebasing process with Medicaid, and we got our rates up with Medicaid. Medicare also improved our rates. And then when we get a little further down in looking at our financials, the team, we've been able to reduce expenses by $1 million. So while you may say, hey, why are we falling short on our gross revenues? It's because we didn't have to do such a large increase in rates to get to that bottom line. We really wanted to make sure that we're conservative in how this impacted patients and the community. We have seen over the last couple of months a little lighter volume, more so in swing bed services, but that is starting to rebound here. That can happen at different times. You just never can predict the frequency of illness and things of that nature. Long-term care has been strong earlier this year, but has been a little lighter in terms of the number of nursing home people in that facility. But you can see the gross revenues there for the month, almost 2.2 million. So it's down from our budget, 462,000, but not to be concerned, as I indicated. Our net revenues are doing better. So you see as we come down to the net revenue line for the month, 1.6 million compared to a budget of 2 million. As we further come down, you can see total operating revenues, almost 1.8 million compared to a budget of 2.4. We'd anticipated some funds to come through on a grant. It was called the Emergency Rural Healthcare Grant Tract 1, but that program was not available to us. And we were hoping it would, but it didn't turn out to be available to us, but it was put in the budget. Now, as we come down just a little further, you can see that our expenses are much better than anticipated. We do see a net income of a negative 191,000 as compared to a budget of 416. It's okay, not to worry. 1 month doesn't make a year. I'll show you the totals here. And then as you get down into it's listed as not operating, but I prefer to describe those as capital. That's where we're seeing the grants and the costs for the construction very strong. So we see a bottom line there. But I think what's more important is just to recap really quick here what's our year-to-date performance? As indicated, we can have a slightly seasonal experience where we can see revenues from the inpatient or something to be down, but where do things look in terms of year-to-date and how will we finish the year? So gross revenues, once again, we're light there as described because we didn't increase the charge master as anticipated. But as we get down to the net patient revenues, we're about 18,500,000 as compared to a budget of 19,368,000. If you come over here to the far side, I just wanted to point out the 16 million, that's how much we had incurred year to date last year. So we're up a couple $1 million over the prior year. We just didn't quite get all the way that we had budgeted for because we didn't do those charge master increases. So we're off a little bit, 880,000. As we come down to the expenses here, once again, you can see right down here on the operating expenses line that we are $1 million under budget in expenses. And we're actually under with regards to expenses year to date for the same time the prior year. So kudos once again. We're trying to manage our financial stewardship as best as possible, and it's coming out well. So year to date, we are showing a $524,000 positive bottom line on the operating line. That's operating expenses, so staff and supplies and utilities, all those kinds of things versus our operating revenues. And then down here, these last few lines, this $6 million creating a huge bottom line that has to deal with the Treasury grant, HRSA grant, and the construction project. Once again, I explain this all the time. We record the revenues as we complete that portion of the project. The expenses for this project will appear in future years when we depreciate the assets. So there's a misalignment of revenues to expenses over time. Okay. Any questions on the income statement? Balance sheet is looking strong. We have some good cash. As was indicated, we have some year-end large payments that we make. We have the annual premium for our insurance and a couple other things. And so we may dip into some of our reserves, but we'll replace that as we get some settlements from Medicare through the year-end process with regards to our cost reports. The accounts payable looks really high, but that's due to the fact that right at the end of the month, we receive a large payout for the construction project. We receive the money for that, but then, you know, in the following few days, we would distribute those funds, and then accounts payable comes down. If we were able to separate the construction from our operations, we wouldn't see much of a difference there with regards to our accounts payable for operations. So, okay. Big projects. We have selected our auditor for the coming year, a company out of Spokane, Washington, DCA. We've completed the engagement with them and had a kickoff call. In the coming month, we will complete the budget. We will complete the renewal of our two different types of insurance, our health insurance, as well as our just general malpractice, other types of insurance. That'll kind of happens as we finish up the fiscal year prior to starting the new year. So a couple of interesting things going on there. I'm not sure if you've already heard, maybe it was in the reports. The health insurance looks like it'll be up about 10% over the prior year. Continue to try to do the best we can to manage those expenses, but that's after competitively bidding it with a couple of different firms, that's where it's shaking out at. So any other questions on financials? Okay, I look forward to another great financial year this coming year with the projects that I'm hearing from the department managers. They got a lot of good ideas going on. Thank you.
Thank you, Jason. New business employee surveys.
Okay, is Katie online? Yes, okay. All right, as I mentioned in the report, in the executive report, we did an employee survey to get an idea, a baseline of where we are as a facility. So just a few things. We pushed it really a hard initiative to try to not just get a small percentage. A lot of times when you do surveys, you'll get someone that's really happy and you get somebody that's really, really upset. And we really, to get a good idea of what's going on in the facility, I was pushing for a 90% response rate. And so we did get close to that, which I was very excited about. And then Katie's going to provide sort of a high-level overview. We're going to do a bigger drill down internally and have some action items as well. So Katie, do you mind providing some of that?
There we go. We have audio now. Can you hear me all right?
Yeah.
All right. Great to be here with you all. Thank you so much for your time. I'm going to just share a screen here. I can. And we'll get this into a presenter view. Are you seeing a full screen there, Phil, or is it still showing you the PowerPoint itself?
Just, it's showing the PowerPoint still.
All right, here, let me try one more time. We'll do this. And we'll get this, I believe. Okay, got everything we need? Got the screen right?
There it goes. Yeah,
Okay, great. Um,
there you go. Yeah, if you minimize that.
moved over, yeah. We will be getting this out to you as a PDF addendum as well. We've just been going through this data this week and still have quite a bit to do. But just to give a quick overview of this, I'm here to speak about work that's been done by Steph Romine, of course, PMC's quality management nurse, and Scott Zweifel from Human Resources with guidance from Phil and Karen. And this employee satisfaction survey that was just completed at PMC was really undertaken in response to the stated board objectives and strategic plan with the goal of developing a baseline and indicators for addressing workplace wellness. So the survey draws on the Quality Monitoring Improvement Field's Plan, Do, Study, Act approach, and it's part of PMC's overall work to make sure we're providing a positive workplace with open communication and opportunities for growth that supports retention of our most important non-renewable resource, which is our people. And Steph designed this survey with 5 main goals, to improve employee job satisfaction and retention, to improve communication throughout the organization, to foster employee engagement, to meet and measure those strategic plan objectives related to workforce wellness, and to identify areas where improvement is needed and formulate an action plan to address those using that Plan, Do, Study, Act cycle. So Steph used national data to kind of scaffold the questions on PMC's survey so we could have an external measure to compare against in addition to developing our own internal benchmarks. The Conference Board's annual U.S. Worker Satisfaction Survey has been conducted annually since 1987. And I am not sure, not having been in the room, I don't know how impossibly tiny that graph is to read, but they reported an increase in the national average overall job satisfaction last year to just over 62% of folks. So Scott built out our survey in Paylocity for easy assignment and distribution to employees. And then there was strong outreach from HR and the administration on that. And, this really paid off in a big way. Phil mentioned out of 151 employees, 85% completed the survey. And that's especially impressive to me because 13% of our eligible employees are seasonal and include other folks who may not even be on PMC email or using Paylocity right now. The survey is anonymous, so we don't know how much of an overlap exists between the missing 15% and that 13%, but it's still a pretty darn good turnout from this staff. And we saw a lot of generous and thoughtful engagement. Of the folks who responded, 83% took the time to explain their survey responses, share their experiences working here, offer suggestions and appreciation. So there's understandably a lot of data in this survey, and the team that designed it is just beginning to get into it. So it'll be used over the coming month to sort of establish these measures for monitoring and improving quality and workplace wellness. But we wanted to share with you tonight just a brief overview of the overall satisfaction. So you'll remember that national number, there's a notable increase to 62% average satisfaction in 2023. And at PMC, our average rate of satisfied and very satisfied employees is 84%. And specifically notable, and I think this speaks to the PMC team and just the energy and commitment they bring to the work they do for this community. 81% of the employees agree or strongly agree they have the support and resources they need to do their job. 84% are satisfied or very satisfied with their workplace relationships. 87% agree or strongly agree that their supervisor encourages open communication. And while it's really affirming to see how PMC's workplace compares with the national data, there we go. The goal of this survey is really to dive in and look for opportunities to improve where we need to and strengthen what we offer to people. And so to that end, I wanted to show just one way that we're looking through this data to see where people are telling us they need more support or they have some ideas to share. So this slide kind of breaks out the staff who responded by their length of employment with PMC. You'll see that white circle on the graph represents the satisfaction level of newer employees who've been with PMC less than a year. The light blue circle shows the average satisfaction of folks who've been here 1 to 5 years. And you can see there's a difference there. And then the dark blue circle represents the staff who've been with us for over 5 years, who have an average overall job satisfaction of 89%. And Phil was asking me, why don't you start this chart at 0? You'll notice I've got the lowest end of the x-axis is set to 50%. And it's a great question because, x-axis trickery can really skew perception of data. But in this case, it's for a good reason. It's because what we're interested in is quality improvement. It's the differences within our staff experience, even if that overall staff experience is toward the high end in positivity as it's being expressed. And if we start the graph at 0, our ratings fall so much into the higher end that you start to lose the difference between, say, 78% and 89%. In our context, it's a meaningful difference. And that's kind of where the interesting stuff is in the data. So again, hopefully this isn't too impossible to read on the PDF, will be sent on as an addendum, I believe, but this chart offers that same breakout of folks by their length of employment across each of our survey areas. So the different topics that we asked people about specifically. And this just gives a little more insight into some of where the differences fall. So some of these areas like supervisor communication, for instance, there's a lot of agreement, it's toward the higher end. In others, people's satisfaction with their opportunities for training and professional development, for instance, there's a pretty big spread there between people who just joined our staff and people who started, right before or since 2020. And Phil was noticing when we talked about this data previously that this issue in particular, it's not a surprise. It's good to see it confirmed by data, but sort of one that folks have been aware of. The training budget is already being increased for the coming year, and we have seen so much success in these grow our own programs that some departments have developed, and there may be some great new opportunities that staff can help identify on this issue in particular. And then you keep looking and, when it comes to people being satisfied with knowing how concerns are being addressed, we've got some work to do, which is why you do the survey. These are the good things to find out. And the quality improvement team is looking forward to sort of applying this information and setting those new benchmarks and actions moving forward. And then, even as we are looking into those differences and those ways we can improve, it's good to remember where we fall in terms of that national average that Steph benchmarked the survey questions against, that there really is, a lot to be proud of in this team and how they support each other and what the workplace is like. And I just want to say, thank you to the folks who designed the survey and took the time to put the board's objectives into living action, and also to this incredible team of professionals who, with everything they're doing, took time to thoughtfully complete the survey. To have over 80% of folks really take the time to write out their thoughts impressed me. I found it moving. So I have a lot of appreciation, and if there are questions that I can answer, I'd be happy to try. And otherwise, I can try and get answers from other folks who know better. Thank you so much.
Any questions for Katie? Thank you for that report. Moving on to board review and approval PERS amendment for part-time employees. Background, PMC part-time employees have expressed the desire to remove the requirement to participate in PERS. Amending the existing PERS agreement related to PMC part-time employees would result in a substantial benefit to PMC and its staff. The proposed amendment removing the requirement for part-time employee participation offers the following advantages. Staffing flexibility, the 15 hours a week to 30 hours biweekly requirement is very cumbersome and would assist facility-wide. PERS retirees, greater flexibility with hiring applicants. Many PERS retirees have sought employment with PMC, and removing this requirement would enable their part-time employment as a non-PERS employee. Part-time opt-out, part-time employees have requested opting out of PERS, which is not allowed under our current agreement. They prefer to pay into Social Security. Not ideal. The Tier 4 DCR plan is not ideal for part-time employees who are forced to join after 3 months and takes literally years to vest. So for the purpose of discussion, moving on, I would entertain a motion as follows. Whereas the Petersburg Medical Center wishes to discontinue the fringe benefits of its permanent part-time employees by withdrawing them from PERS plan effective July 1, 2024. Now therefore be it resolved by the Petersburg Medical Center Board of Directors of the Petersburg Medical Center of Petersburg, Alaska, that 1, pursuant to AS 39.35.615, the Medical Center Board of Petersburg Medical Center hereby requests permission to withdraw permanent part-time employees from the Public Employees Retirement System of Alaska effective July 1st, 2024. 2, all permanent full-time employees of Petersburg Medical Center shall be participating members of the Public Employees Retirement System of Alaska. Do I have a motion to support that?
I'll move that we approve resolution 2024-01.
Is there a second?
I'll second it for purposes of discussion.
Okay, did we have some clarification from anyone out there?
Cindy's the one who helped prepare so I'll have her, presentation.
Hi, so can you hear me? Okay. To give you some background information, January 1st, 1980, Petersburg General Hospital at that time became its own entity. We had been in PERS under the city of Petersburg. It did include full-time and part-time employees. December 10th, the hospital board amended this to exclude part-time employees effective the date of the resolution, which was December 10th, 1987. July 1st, 1990, Petersburg Medical Center, Petersburg General Hospital added part-time employees. July 1st, 1991, Petersburg Medical Center excluded part-time employees. July 1st, 1999, Petersburg Medical Center reinstated part-time employees into the system with the participation agreement. Mr. Bringhurst at the time was our CEO. The main reason was because we had some part-time employees who were in tier 1, 2, or 3. At that time, tier 4, the defined contribution, the DCR did not exist. And our part-time employees wanted their retirement. Currently, we have no part-time employees in the defined benefit plan, tier 1 through 3. And one of the things that Mr. Bringhurst did to help offset the cost of the PERS program was we had 10 paid holidays, 10 holidays that we were closed to visits, to clinic visits. So what he did was he made it so that 2 of those days would be floating days and we would not close so that we could stay open because PMC actually makes a little bit more money if our clinic and our lab and our PT and OTs and speech can all see patients. So as an HR person, when we are hiring people, and especially people who do not want to work full-time and do not want to join PERS because the tier 4 is just not a very good plan. And I don't mean to speak ill of the public employees retirement system, but 1 through 3 is a defined benefit. And this is a defined contribution. They're 2 separate things. It would not hurt our employees. There are, as I mentioned, no defined benefit people in this. We have 9 PERS tier 4 participants that are part-time, that are in tier 4. We have 112 that are full-time tier 4 employees, and we have 13 defined benefit employees. One of the things that we have been asked previously, whether it's in nursing or the clinic or throughout our facility, is if people can work without joining PERS because they don't want to join it, they'd rather pay into Social Security. And I'm not here to debate whether Social Security is better or PERS. It's just one of the things that our employees have requested. When I was talking to our PERS rep, he said, well, you used to not have timers in PERS. I don't think it'll be any issue. So to make sure we were on the right road, I double checked with Jason in finance so he could look at the tier 4 plan. And he agreed this wasn't a very good plan, especially for part-timers. I also asked Phil if we could send it to legal, which we did. The city was concerned, the borough was concerned because they thought we might be opting out of Social Security. No, we want to put our part-time people in Social Security. And legal thought it was fine. Our PERS representative didn't have an issue with it either. So that's kind of the background of the request. Just as an FYI, in nursing, the shift for nursing is 12.5 hours. You can't work 2 shifts unless you're part-time in PERS, because that's 25 hours. If we weren't in PERS, it would just give us better flexibility for all of our departments, for food service as well. I think when you're looking at employees and staffing, we struggle, I think, like every employer in Petersburg. We need people to work and we want them to work for us and to feel like it is beneficial to them. And not only that, I mean, we do have 4 retirees that work for us. We have to watch their hours like a hawk because if you're a PERS retiree, you cannot work in a PERS position more than up to 15 hours. So it'd have to be 14.75 a week or 29.75 biweekly. We are on biweekly payroll. So if I talk about biweekly a lot, it's just second nature to me. So that was kind of my idea. I brought it to Phil and Jason. I said, this is what I think we should do. I think it would give us a lot more flexibility. I think it would help our department heads. And so that's why we're here.
Would this plan allow people, part-time people, to opt into PERS if they wanted to, or would it just cut it out for part-time?
It would cut it out for part-time. If they went full-time, they could go into tier 4. Nothing will happen to their tier 4. Their tier 4 will remain there just like any other PERS employee. So it just stays there. It accrues interest. And if you go back into a position that is a PERS position that is benefited, and it could be somewhere else, like for the school or the city, you could. The thing I hope people won't do is take a refund. I never recommend a refund because then that period of time that you've worked, there is nothing for your retirement because you've been paying into PERS and not Social Security. So, but we have had employees do that too, just because they quit, then they come back 3 months later. And I'm like, please don't do that. You have nothing for, you know, those years that you've spent working. But I know times are tough on people, so, you know, and we most of the time would love to have the person back, so we rehire them. But, I think it would really benefit us, and, in this current program, I don't think it hurts the people who are part-time. We have one person who's part-time who's already vested in Tier 4, so it would not affect her, and we have one person who is, at 3.9, which 4 years is to vest and get the employer portion in Tier 4. And I brought the tier charts if you want to look at them. I brought the paperwork if you want to see it. It goes back and forth for years. And the lawyers email saying that we were good to go ahead and present it.
I've got one other question do you have reason to believe that if the retirees that are presently working there, would they work more hours probably if they were able to at this class?
Then we could have them be full-time.
So am I understanding correctly that it would currently affect 9 current employees?
Yes, that are in the first Tier 4.
And are all 9 employees in agreement that they want to go in this direction?
We have not presented it to them. I mean, we
So once we pass this, they wouldn't have the option. They would just not be.
they would go into Social Security, the
So if they wanted to stay in the PERS system, that's Tier 4, they'd have to go full-time. And my other question, sorry, Cindy.
No, that's okay, go ahead.
When they kept flip-flopping, going back into the PERS system, going out back in, I'm assuming that this was all, I know you said it was long before 2006 when they went to Tier 4.
Yes. Our last time when we went back to including part-time was 1999, July 1st, 1999. It was approved by the board in June.
Okay, my last question is, have you had very many people that want to work part-time to like finish out like their PERS, like say they're at Tier 1, 2, or 3?
Not really. The Tier 1s through 3s are really, as you can tell, there's 13 that are in it and there's 112 that are in Tier 4. So you had to have joined PERS prior to 2006.
Yeah, so they're most likely if there was anybody, they'd be a Tier 3 at this point, if you look at the age of people.
And honestly, the defined benefit is an excellent plan. I mean, one of the reasons why the state went to Tier 4 is, as you all know, is because it was expensive for the state and it is an indebted program. So that's why they're waiting for all of us Tier 1 through 3 to retire and get out of it and die, which I don't mean to be morbid, but so that we're not in it anymore and not costing them. But most Tier 1 through 3, and I don't want to speak for everybody that is 1 through 3, we work full-time because we realize it is a really good benefit.
What would be, like, we have these 9 part-time employees that are in the PERS system. If someone didn't like, they're going into what would be the cons of it, the negative?
The negative would be that they were no longer in the system. So Social Security, and I think where everybody's familiar with Social Security is with the defined contribution, you can go on if you are pretty savvy with retirements and try to figure out what you should invest in, basically. The biggest problem with that is most people honestly don't know. And often I'll get asked, and I'm an HR person, I'm not a person that can advise you on investments. Although, they'll ask. So the way you're set up in a Tier 4 is they take your age, your sex, and how long they think, your age, how long you have in the workforce. And then they just use some generic formula and put it in to work for you. I don't know if anybody here that's a tier 4 ever looks at theirs, or do you do any manipulation of your accounts or anything like that? It's set up like a, basically a, deduction into, I don't want to say, the market, but basically that.
Yeah, there's like apps now where you can go in and change how aggressively and stuff. So like you said, how many people do that? I was just concerned for the 9 employees, if that would upset them or kind of
Currently-
disrupt their future planning.
We have 2 that are over 1 year or more, and the others are all 1 year or less. And this is as of 5/9, which is when I looked at it for Phil, just because I wanted to make sure, were we gonna impact a lot of people?
So I understand the flexibility benefit to the hospital, but I have 2 concerns from the employee standpoint, and one is that it sounds like we haven't canvassed them on something that would affect them immediately, and the other is I keep hearing about the insolvency of Social Security in the future, and we may be making a decision that also impacts their ability to get a benefit in the future. And I don't know about the health of the PERS system in comparison, but I'm a little reluctant to vote on positively on this at this time. I feel like we need more information.
I agree with Cindy. I think we need to canvass the 9 employees.
Anything they've paid in right now would remain in an account for them, correct?
Yes, yes. They would have to ask for a refund to get it out, so it would just remain in there.
And so whatever they've been paying in on with each check would now go into their regular paycheck, correct? Or would it be going into Social Security?
It'd be going into Social Security. So 8% goes to tier 4, and then 6.75 is Social Security. So it's a little bit less, I mean, percentage wise, but
Cindy, I have a question. Cindy, when is it, the date that we have to make that decision to get it into the July 1? Would that be, do you have another month for that? Could we come back next month and have that information and follow up?
I could talk, Scott Seipel, or I could talk to each employee and just
Yeah.
see what their thoughts are.
And also it might not be a bad idea to, I know, we have a legal review, but just to make sure that, maybe the borough has a chance, the attorney has a chance to look at it, just to make sure there's nothing there. I know I had talked to the assembly a little bit and, just to vet that a little bit. And so maybe what we'll do is Cindy can, talk to the employees, and then we could just have it, reviewed a little bit with the city attorney, just make sure everything is good, even though I'm sure it's fine. And I do agree with Cindy. Cindy's been talking about this for a while. And it is a comment that comes up. And as a person, who has unfamiliar with PERS, Cindy, even though she's not a benefits manager, or so she says, she knows this stuff inside. She knows PERS like no tomorrow. And I'm used to Social Security. So actually, when I moved here, I was actually pretty shocked that I don't get to put it in Social Security. So I actually, as an employee, I didn't know anything about PERS. And so I was really surprised, and not in a good way, because I've been accumulating Social Security since I was like 15, 16 years old. So to me, I get it, I understand it, and I believe Cindy. She's been in HR a long time, and she always represents our employees. So I think maybe we just do a little homework on that part, and then we'll do a legal homework, and we'll bring it back.
So I think I'd like to withdraw my motion then, and we can discuss it at a future time.
Can I ask one question of Cindy? In the defined contribution program, what percentage of a person's income goes into retirement?
Says right on that paperwork, it's 5.
So 5% of their income goes into retirement. And that's to cover both for their retirement and for what's not paid into Social Security, correct?
we put 5%, the employee puts in 8%. So in all, every check, 13% goes into PERS.
And the rest is the indebtedness.
Right.
So,
Whereas Social Security, 6.2 and 6.2. So, you know, if we just had Social Security employees, we would contribute 6.2% and then the employee would be deducted 6.2%. So in total, Social Security would be getting 12.4%. So in PERS, what's happening is we're deducting 8% from the employee and then we put 5% in, so 13% goes to the state. But the negative part to the people that are in the plan is, you know, let's say that they only end up contributing 50,000, and when they retire, all they have is the 50,000. When that's gone, it's gone. Whereas everybody knows that Social Security is an enduring benefit. And again, to your point, Cindy, assuming that the Social Security fund, yeah, right.
Fingers crossed.
Right.
and really, the Social Security is a federal, I mean, we're always looking into, it sounds maybe not good, but like even for our insurance, we were hoping to get a federal way that we could be on federal Blue Cross because our insurance goes up so much constantly. And so, you know, I understand that it's a little, it's something we will check with the employees just to make sure they're good on. I mean, you have probably majority of them say, boy, I wish I wasn't in PERS, but on the other hand, like you said, there could be a few that want to be staying in it.
So they like, it's kind of tricky for people to understand, so that like right now they're not paying into Social Security. If they're tier 4 people, they probably likely have been, so they would likely see that it's better benefit to continue getting their Social Security orders and stuff.
Joe?
Yeah, I appreciate the background, Cindy, on all this, and you answered some of the questions I had on this with your narrative there before when we started, and I appreciate the thoughts of the other board members here too on this. Is this a change to hospital policy or to our bylaws? Does anyone?
Not to our
Policy,
bylaws,
yeah.
but to, it would be a change in our policy as far as who is required to join the public employees requirements, the retirement system. So anybody working over 30 or over a week or 60 over biweekly would still be in PERS. It would be the others who would not. And it would be a change to our policy manual, basically, and to our retirements as far as who's contributing. The 22% the employer pays, as Joel mentioned, is a lot of it, and we probably know this with living in the state of Alaska, is going to the indebtedness of the PERS retirement. And one of the problems the state has faced is that tier 4 is not as nice looking or, you know, as it's not as easy to recruit people to the state because tier 4 is not considered a really good plan, unfortunately. Although the employer portion is high, it is not going to that program. It is going to the indebtedness because of the tier 1 through 3.
The other question I had is that, is this change being sought in part to increase the number of part-time jobs at the hospital? Is that part of it?
Yes, and so the thing that would change is the benefit for the insurance, for the retirement. The benefits, if you're part-time, would still remain as far as PTO and sick leave and, you know, the holidays and the insurance, the medical insurance, all of those would remain. It would just be, the retirement would be at full-time, at 30 or 60 hours.
Right, but is the hospital looking at creating more part-time positions in the future?
Really, we prefer people to work full-time, to be honest, but if it can help us to staff, for a while there, Jeanette, for example, hired quite a few people on part-time, hoping they would go full-time. They eventually actually did.
Yeah, they did. That's actually been really interesting. I have 10 employees And I think 3 of them now have gone full-time, but almost everyone I recruited was part-time, and that's what they wanted. They came to me wanting part-time. I had both positions open, a full-time position and a part-time, just to see who wanted to come work. And it was people wanting a part-time. And then they get in and they liked it, so.
Go ahead.
Yeah, you mentioned that, and I think part of this, I mean, I can understand the flexibility as part of this, and I can understand that perhaps, and we don't know for sure, but it sounds like perhaps most of the current part-time employees would favor the switch, but there are other PERS employees in Petersburg who work at the borough, who work for the state, and they might be interested in part-time work, and they may be interested in part-time work where they can continue paying into their PERS. So that's something I think to consider with this as well. Thank you.
So it sounds like we would like to get a canvas of those employees to see their feelings on it. I don't think anyone here is really comfortable with pulling the rug out from under someone if they all want to be in that program still. So if you could do that for us. From a procedural standpoint, if she withdraws her motion, does that just stop there? Or do we table it? I mean, what's the difference from a procedural standpoint?
It would be best to table it so that it could be brought back off the table next month.
So,
I'm in agreement with that.
okay, yeah, because
I'll table the motion.
so the motion and the second was still there, but it's tabled. We'll table it till next month then.
I, one question.
Yes, sir.
Cindy, if we find out that all of a sudden we're losing employees or it's not working out next year, could we put it back, reinstate it?
Actually, yes. The odd thing about this, and if you look at the history, how many times the hospital has gone back and forth, it is just an amendment to our participation agreement.
I have one last question. So it's not possible to be a part-time employee and choose in or out. The policy is black or white. You don't, okay.
If you're working over those hours, it is absolute. And for me, you know, just having people come and say, well, you know, I'm not going to work then, it's just like, it's very difficult, especially when we're trying to staff upstairs or MAs in the clinic or whatever it might be.
Thank you. So we'll table that subject till next meeting. If you could get that information from those employees, just so we have I think it'll give everyone a better feeling here if we know how they're going to feel about it. Be easier to make that decision. Is there anything else before we look at next meeting? That'd be the 27th of June, is that correct? Of June. Do I have a motion for adjournment?
I will this is Joe. I'll make a motion that we adjourn.
All in favor?
Aye.
Thank you.